Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Mark Darrow. We're taking your calls at 866-870-5752. Right here in the studio, you can speak with Dr. Darrow. You can check out the website at www.lastemcells.com. That's www.lastemcells.com. And you get your free book. This is the best part of all. Dr. Darrow's latest is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with over 264 scientific studies. So call now, 866-870-5752. Do you want to go to Patty?
I do. Patty, hi, it's Dr. Mark Darrow. Just
Hello,
give me
Dr.
one
Darrow.
second. I want to just talk about something that's hysterical. I have a patient who's listening on the radio right now who's too shy to call in, but he's texting me, and he sent me photographs of his friends and their x-rays after surgery, and it's just horrific what I'm seeing here. This is neck fusion on one who's still miserable afterwards, and this is a shoulder replacement on another, and it's showing all the scars and stuff and how they're worse after the surgeries. And this guy, we call him Dan the Man. He's from Montana. He's a great big guy. He's real funny. I don't know, Dan, why you're being shy. You're not shy in the office. Oh, and then he says, this is texting. He says, tell your audience. Dan, you are so funny. He goes, tell your audience this. I had neck stem cells the other day from you. In 5 seconds, with your touch of God, I diagnosed it as ligament sprain. I've had a horrible neck since I was 14. I don't want to jinx this, but these last few days have been amazingly pain-free, discomfort-free, twitching-free, almost a miracle. And then he just texted again, my knees are doing really great. And this guy was a football player. He's a great big guy. He played football for the Hawaiian university team. And let's see, not in a place where I can hear, very noisy here at work, set up another time. Besides, my agent might want an appearance fee. Oh, this guy is funny. He cracks
He's hilarious. That's
yeah,
cute.
he's a really, really nice guy. So Dan, God bless you for texting me right
funny.
now. But he's having really miracle healings. This is a football player whose body has just been literally demolished by playing football when he was in college. But he's getting better. He's able to go hiking now. His pain in his body is going away. His neck is good. So now we're going to Patty. Your knee and your back. Which is worse, Patty? This is Dr. Mark Darrow. Tell me about it.
Oh, right now the knees, I cannot walk. Okay. And I'm wondering if stem cells would help, because if they're too far gone, because I can bend them coming down the stairs, but they hurt.
Sure.
But, I can bend them still a little when I walk, but now they're to the point where I don't want to walk. Okay,
I understand. I've been there, and I've injected both my knees with stem cells and platelets, and I'm doing good. I'm going to go running a little bit later today. Maybe the golf course. I don't know. Looks like a nice day. If you've lost your cartilage and there's not any room in there, then there's no cartilage holding open space, then can the stem cells still get in there or not? Well, let's talk about what that means. A lot of surgeons call that bone on bone, and I rarely, if ever, find anyone who has bone on bone or no cartilage. All right? I just had someone come in yesterday. I looked at the x-ray, and the outer edge of the right knee had very thick cartilage, and the inner part, the medial part, had very little cartilage. And that person was told they needed a knee replacement because there was no cartilage. There was bone on bone. When I did the examination, the knee felt perfect. How can that be?
Yeah, but I'm afraid it's not going to be that way in my case because I've been told for 30 years that I need a knee replacement.
Hey, but what does that tell you? You've been told for 30 years. You've made it this far.
Pardon?
So let me just explain a few things, if you don't mind, Patty. Number one, we all live in a fantasy. Everybody's fantasy is different. Your fantasy is that you've been told for 30 years you need a knee replacement, therefore you need a knee replacement. My fantasy is different. My fantasy is that hopefully I can help you and make you feel better by injecting stem cells and platelets. So we both have different fantasies. I won't know until I examine you. I never trust other doctors' diagnoses because the tradition in medicine is to medicate and operate. Okay? That's not my tradition. That was growing up in medicine, but from my own injuries, I learned that I can help myself heal. And I've had a lot of doctors tell me I need surgery. I had one on my shoulder that failed miserably, and I healed it afterwards by injecting myself. So I don't buy traditional medicine. It is necessary if you're very sick, then traditional medicine is good. But for orthopedics, I like what I do a lot better. I could have finished up with orthopedic surgery and been a surgeon, but after my surgery, I was like, I'm not going to do that to people. And since then, I've had way too many people have surgeries who have come out bad. I'm not blaming the surgeon for that. It's just what it is. I love surgeons. Have you listened to my show before, Patty?
Oh, yes, for quite a few years.
Okay, so you know my story. You know my shtick. My shtick is, why do something that's very invasive that can hurt you when you can do something or try something conservative, like just getting some injections?
Well, that's why I never did it, but I think I waited a bit long now. But
I don't think you've waited a bit. I don't think you've waited too long. And
I hope not. But and then I have the issue of the buttocks on the left side.
Okay.
I try Performance exercises.
Sure.
And it hasn't helped.
Okay.
And I'm wondering if that's nerve damage or
no. I doubt that.
Coming from the back.
No, the area where was it a physical therapist or someone told you piriformis syndrome? No, I've never really found one of those. I've had 1,000 people or so probably come in saying they have piriformis syndrome. It's usually in an area where the piriformis muscle attaches to the greater trochanter, and you can write those terms down and look them up on Google and then hit images. You'll see where that is. And those are very, very easy to heal using regenerative medicine of platelets and or stem cells. And again, I can't promise you anything, especially since I haven't touched it. I need to do an examination. I get people all day long sending me x-rays saying, am I a candidate? And I go, I have no clue, because the x-rays are big liars and the MRIs are big liars. They don't tell me where pain's coming from. Everybody in the world, if you do a total body scan, you're going to find something wrong with them that they don't even know exists. So it's not really wrong. You get my idea?
Well, I have scoliosis. I wonder if it comes from that or anything.
Again, scoliosis doesn't generally cause pain unless it's really advanced. I get patients all the time with scoliosis, and it's not an issue. So I'm not worried about anything you're telling me so far. So you want to come in, I'll take a look, and we'll decide if we can help you and if it's something you want to do. In the meantime, if I were you, I'd go to the website, www.lastemcells.com, and take a look at the videos and see if the injections are something that you think you want to do. For me, I don't want a surgery. I had one.
I am on blood thinner, but if you get the knees done, you have to be off the blood thinner 5 days?
No, it depends on the blood thinner. The problem with knees is that if I put a needle in there and you're on a blood thinner and I hit a vessel, you can't see them. There's these little teeny vessels that can leak.
Yeah.
And then if the knee gets filled with blood, it's very painful, and you have to come back a couple of days in a row to drain it out. So you'd have to talk to your doctor who gave you the blood thinner. What's the issue? Do you have atrial fibrillation or something like that?
Yeah, and I have heart failure right now.
Okay. So you'd have to talk to him to see if he can be off a blood thinner for a day or so. And then we get a letter from him saying it's okay. And almost everybody's able to get off for a day or so. So that's not usually an issue.
Okay. Thank you for your
Sounds like you're doing your homework, Patty. That's good. You're a smart woman.
Yeah. Okay. Thank you, doctor.
And we don't have to take people off blood thinners except for knees and necks. Those are areas that can bleed. And the rest of the body, it's fine. There's no problems. So we're going to Harry. Hi, Harry. Dr. Mark Darrow. I'm going to give out my phone number to the studio right now. It's 866-870-5752. I'll repeat, 866-870-5752. You call me now, and I'm going to send you out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got all the research on stem cells and platelets and how it works and why surgery is no longer the answer for most musculoskeletal pain. So, Harry, you're calling from Walnut, and you've got a right hip issue. Harry, are you there with us?
Yes.
Tell me about it.
I have problems with my right hip. I have pain where it's hard to put on my socks in there.
Okay.
I could walk for several blocks, then the pain would start coming in.
Okay.
So, and I actually have a friend that I think they went to your clinic and actually had his Achilles done.
All right.
So that got me interested, but then time goes by, then I just put it off, and I'm just listening to the radio, and here I think you're the same doctor that treated him.
Okay. So let me just tell you real quick before we get to you. I see a lot of Achilles tendonitis or Achilles tears, and the first time I did one of them was a baseball player, and on the right side it was normal looking. It was very thin. The Achilles tendon is coming down from the posterior calf down to the heel, the calcaneus, and when we contract our calf, that pulls on the calcaneus, and the foot dorsiflexes. It comes up. The toes come up. So it's very easy to injure it, rip it, and from overuse, like a lot of running or jumping or baseball, things like that, it can get really irritable. And this baseball player on the right side, I'm going to say the Achilles was about 3/4 of a centimeter wide, and on the left side, it was almost an inch thick. That's like 2.5 centimeters. And after doing it a few times, his pain went away, and the Achilles actually shrunk down to the normal size, like on the right side. And it was one of those things to me that was like a miracle. And I've seen this happen over and over and over. And what happens is there's a lot of remodeling that takes place of the tissue when we do regenerative medicine of platelets and stem cells. So I've had people that have lumps on their body where they've torn tendons off and things like that. And it seems to like just heal up and become normal again. So when you talk about your right hip, is it in your groin area you're talking about?
It seems like it's emanating from my joint in there. I actually had x-rays done. Then I had a CAT scan done on it. And they just told me that I'm just getting old. I got arthritis. I actually saw the X-ray, and it looked the same as my left hip in there, but they're just telling me that it's just old age or arthritis there.
Okay. So you just hit the nail on the head. I'm so grateful you just said that, Harry, because this is a take-home learning point for everybody. And I see this every day. I see people who come in with arthritis in one joint, and then what we call the contralateral or the other joint looks the same but has no pain. How can that be?
Right.
It's because you cannot believe your CT, your MRI, or your X-ray. And it probably means that arthritis is not the cause of your pain. A lot of people have arthritis and don't have any pain at all. So why are doctors giving surgeries for arthritis? It's not the right reason. They need to do an exam, move the joint around, and find the pain generator, not find the spot on the MRI. So you're a real smart guy, Harry.
One steroid injection, and that seemed like the pain went away. But then I started walking normal for a long distance, and eventually the pain came back again. And I was told, well, I could have that injection done every 6 months. But it seemed like the procedure, they sort of like put you to sleep, right? Like it's an operation. But
well, I have a couple of feedback points for you on that. Number one, if you look up cortisone, which is a steroid, on Google, you're going to see all the damage it does to cartilage. And when it's on a weight-bearing joint, like a hip, the ankle, the knee, that's weight-bearing, it's going to destroy it because it softens up the tissue in the cartilage, and then you're putting pressure on it to destroy it. So, yeah, you can get away with it once in a while. It's not a good idea really ever to do it if you can help it. And the fact that the steroid made it feel better for a short while is a real good indication that using platelets and or stem cells together can heal it up, because that steroid shot, the cortisone shot, went to the pain generator. The fluid went there, the same as the fluid that I would give you using stem cells and platelets would go to that same spot. When I do it, I don't put anybody to sleep. The shot takes like 2 seconds. I use an ultrasound to guide the needle, and it goes right to the exact spot. Be careful, anybody out there listening, if you're going to get a shot of anything for the musculoskeletal system, make sure your doctor uses an ultrasound to watch where that needle goes. The studies show that blind injections into the knee miss that joint at least 1/3 of the time. So be careful what you're doing.
Yeah, I was told that when they were giving that injection, they actually had like an X-ray machine.
They have a live X-ray, a fluoroscopy that they use. And so, why would you do that? That gives you a lot of radiation. You can use an ultrasound that just gives sound waves that actually, they might help you feel better. But I'm being a little facetious because ultrasound is used for a healing modality, but the kind that I use is not for that. It's just to look, to get an image, and then we can actually see the needle, and we can use that to guide. I don't like fluoroscopy. If you ever watch a doctor doing it, they've got this big lead shield on them to block the X-ray. Well, the patient doesn't have that. So I'm not a fan of fluoroscopy for that.
Yeah, the friend that I had that had his treatment, he's able to play handball again. So I was kind of surprised.
You mean after the Achilles tendon
treatment your office, that did his platelet and stem cell.
Wonderful. So I'm going to give out a couple phone numbers here, Harry. One is to the studio, so we can get some callers, and anyone who calls, we're going to give a free book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate.
I did call the studio number.
And we got you covered, but I'm going to cover other people who want to call in. The number here is 866-870-5752. That's 866-870-5752. You can call me right now and ask questions about yourself or your friends or your family. You can use a fake name if you're shy. And if you want to catch me at the office and get more information, the office number is 800-300-9300. That's 800-300-9300. If you want to watch videos of me doing these procedures, the website is www.lastemcells.com. And I check my emails all day long. I do emails before I go to sleep. I do them when I wake up in the morning. And I get back to every single person who emails me through the website. So we've got a couple other callers coming in. It's getting close to the end of the show. Donald, we're going to take you for your knee. Donald, it's Dr. Mark Darrow. How are you today?
Pretty good. Nice to talk to you. Yeah, my left knee is bone on bone. I've had 2 surgeries. one was for torn ligaments 20 years ago. The other one was shaved the bone about 2 years ago.
Okay.
I have lung disease, so they say the only way to get a knee replacement, I have to be paralyzed, this and that. I might not wake up.
Okay.
Any suggestions what I could do? I mean, the pain's incredible.
Okay. To really be honest with you, I have to examine you. I can give you ideas right now. Obviously.
What city are you in?
I'm sorry? What city? I'm across the freeway from UCLA on Wilshire Boulevard.
What city are you in?
West LA.
West LA?
Yep.
Okay, down next week or so, can I call up, make an appointment? What kind
you can call right now. Yeah. Call right now. You'll get all the information you need. Yeah, 800-300-9300. There's people by the phones, and you'll get all the information you want. All right, Donald, God bless you. There's good hope ahead for you. I'm going to go to Tony now. He's got a tendon issue. Tony, what tendon is it?
Mark?
Yes, sir.
It's my tendon on my left side. I don't even know how it happened, but I pulled it, and I went to get to a doctor, a specialist, and they did an MRI and X-rays, and they said it had minor tears, and what started happening was it started swelling, and the pain was just unbearable.
Okay.
And they scheduled me for surgery. Things happened to where the surgery got canceled.
Okay.
And so it started healing itself, and I just kept the weight off of it.
Oh, wonderful.
But
was this your knee that you're talking about? I didn't hear that.
I'm sorry. No, it's the Achilles tendon.
Oh, your Achilles. Okay.
Heel.
Okay.
Yes. And the problem is right at the heel.
Yeah, that's easy. That's usually pretty easy to fix.
Oh, okay. So you think that might be I'm a candidate for something like a procedure like this, stem cell?
Yeah, if it's not a complete tear. If it's a complete tear, you can have surgery or you can get in a cast till it heals. But if it's not a complete tear, if there's just little tears, we can help you heal it up.
Oh, that's great. Well, I'm going to have to get a hold of you in your office and make an appointment so I can go see you.
I'd appreciate that. I'm going to throw out the number again to the office is 800-300-9300. And Tony, I'd love to see you get that Achilles healed up. And for those of you that want to talk to me right now, you can call into the studio at 866-870-5752. We're going to go to George. He's got back issues and questions about stem cells. Tell me, George, what's going on?
Doctor, this is George. It's not for me, it's for my wife. She has spinal stenosis and significant degenerative disease in the back, and she suffers with sciatica as well as pain in the low back.
Okay.
Can you tell me, does stem cell help that issue? And number two is, how much does it run? Because insurance is not going to cover this, I'm assuming, correct?
You can call the office for information, detailed information like that, but let me give you the medical information because that's what everybody needs to hear. Spinal stenosis means that there's a squeezing of the spinal cord or the nerves that come out from the spinal cord that go down the arms or legs. And if it's, oh boy, go to the website. You can email me and I'll get back to you. It's www.lastemcells.com. And I wish there was more time. God bless you all. Thank you, Nita, Suzette, Alex, and the rest of the staff.
Thank you. And remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens. Thanks for listening, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Mark Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Mark Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.